my book's called Sickened: How the Government Ruined Healthcare and How to Fix It. And one of the things that I talk about in there is that free markets is what's going to fix healthcare, not some universal government plan. I mean, the government already pays for 80% of all healthcare. So if we think it's broken, and if people think it's broken, then how are they going to fix it when they already pay for that much of it? And the reality of it is healthcare is just like any other industry, and we need to let the free market work. Being an actuary, I was on a podcast with somebody last week, and he mentioned that, I think it was him, it might have been somebody else. I talk about this so much, I don't remember. But if you were an insurance actuary, Gayle, I don't know if you were in just healthcare, or did you do auto insurance, and did you do home insurance also?
So the actuary industry in the United States is divided into two pieces. One is the life and health side, which is the side I'm credentialed on. The other side is like car insurance, liability insurance, that sort of thing, which is the casualty actuarial side of the house. And I'm not credentialed on that side. So I'm on the life and health side. The company I worked for did employee benefits, but non-medical benefits. So I wasn't a medical benefit or a medical insurance actuary, but we did dental, life, critical illness, disability, the kinds of coverages that are what we termed ancillary benefits for employee benefits. So not the medical piece, but the other pieces. And you're exactly right that I think actuaries should play an important role in how we think about healthcare. I feel like actuaries should speak out more and have more times or more willingness to get involved or to lend our expertise to the broader healthcare discussion of especially how we pay for healthcare. I think we have a lot to add.
Since we've already used the auto analogy, let's just use the auto analogy with health insurance analogy. So, and I imagine, even though you're not certified as an actuary in auto, I think you can probably relate to this and probably comment on this. So, if somebody gets a drunk driving ticket, their insurance rates go sky high, right?
Yep.
Right. So maybe should smokers, should people that are, drink in excess, do drugs, should people that are obese, should they pay higher health insurance premiums? I mean, those are questions we have to ask ourselves.
Yeah, I think we do need to ask ourselves those questions. Smoking status is one of the few lifestyle factors, if you will, that the Affordable Care Act and other things that we have in place for healthcare in this country, they do allow rating to vary by smoking status. It cannot vary by some of the other things you mentioned. But I think it's a great question that we should be more open to discussing and having dialogue about in this country, is that so much of our healthcare costs are connected to lifestyle factors. And in my view, I think we've done a disservice by trying to get rid of the usage of a lot of those factors, and not so much from the standpoint of, we want to penalize people that aren't making good choices, but just to make the connection in people's mind that you are responsible for your own health. And I think the way we think about healthcare in this country, I think we try to think about it as we're helping people, but by removing all of the connections of your own choices and your own behavior from the healthcare, from your health and the subsequent healthcare that you use, I don't think in the end that's really helping us, because it kind of perpetuates the notion that everybody's just entitled to as much healthcare as they need or want, without regard to your own choices. Where, lifestyle choices and things like that certainly are a huge part of what your health will be and what your health expenses will be.